Hello, Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient you had requested. The area of interest is the upper right 6 and 7. For fracture, upper right 6 is on both sides of fracture evaluation. On the axial view, now we're looking at the upper left 6. The upper left 6 does not have a very clear crack line, but we only see one particular aspect, which is right here, extending distally, as you can see, as we marked with the red line here. While we're moving a little apically, you will be able to notice that there is a very severe cavity which is present right here, right? So we can actually notice how there's a cavity in the parietal aspect which is approaching into the pulp space right here. And this cavity is just above the crest of the bone on the parietal side of the tooth. Moving more apically, you'll actually see that there's significant bone loss on the mesial as well as the distal aspect of the stool. So there is bone loss to the point where it is very close to the apical one third of the tooth. There is significant bone loss. It might be associated with the crack, it might be associated with periodontal disease. We cannot confirm. The crack does not extend all the way down towards the root, which is why you don't see a periapical radiolucency. When we look at the tooth from a coronal point of view, this is where the bone loss is on the distal aspect. This is where the cavity is on the parietal aspect, and then we have mild sinusitis, and we can see in this tooth as well. So no periapical radiolucency, but we do see mild sinusitis associated with this tooth. Now we're going to move to the tooth on the right side, the right six. The right six On the upper right 6, we can actually see a crack extending from the distrobuccal canal towards the distal aspect. And we can also see a radiolucency associated with this. So hence we can confirm the upper right 6 does show a crack, which is also associated with a periapical radiolucency. Another crack that we see is in the mesial aspect, which can be visualized here. This is the mediobuccal canal and the mesial ridge of the tooth. So we don't see anything on the superficial aspect, but as we are moving down towards the inside of the tooth, we can actually see a very clear crack associated with the distrobuccal root right here. So VRF, a vertical root fracture, is definitely present here. This is the coronal view. The coronal view shows that this tooth has two canals, MB1 and MB2. You've got a parietal canal, and then you've got the distal root associated. Here you can also see that there's significant bone loss in the distal aspect, which can be associated with the crack on the distrobuccal root. This is the sagittal view. So here also you can see significant bone loss, especially on the distal aspect of the tooth, and hence we can very comfortably say that there is evidence of a crack present in the upper right 6 region. Thank you very much.